Ensor with me today. Uh, Good afternoon, and thank you for joining us today for a very special announcement. As I indicated, joining me on stage is Houston Health Department Director, Director Williams, Dr. Purse, the Chief Medical Officer for the City of Houston, Dr. Laura Hopkins, the Chief Environmental Science Officer for the Houston Health Department, Dr. Kathy Ensor with Rice University, and Houston Public, Carol Haddock with the Houston Public Works Department will probably be on her way. And then I'm also joined by Council Member Abby Kamen of District C. The City of Houston is proud to announce today that the Houston Health Department is the recipient of the Centers for Disease Control and Prevention's National Wastewater Surveillance System Center of Excellence Award for its work in wastewater epidemiology. Very, very proud of them for that. This system forms part of the city's response to the COVID-19 pandemic. In May of 2020, the Houston Health Department gathered a team of partners to develop and implement a SARS-CoV-2 wastewater surveillance system for Houston. Researchers, scientists, engineers, and public health professionals from Public Works, Rice University were all part of this extraordinary team that developed this system for the city. This monitoring system allows the department to provide data tracking of the COVID-19 virus in our communities. Through our wastewater surveillance system, the health department can pinpoint the level of COVID-19 virus in our city and better deploy public health resources to areas of the city where the virus is more prevalent. Today, COVID-19 wastewater surveillance monitors Houston's 39 wastewater treatment plants, 73 manholes, and 63 lift stations serving 2.16 million people. In addition to servicing this country's fourth most populous city, our wastewater system is one of the largest separate sewer systems in the nation. And I want to take this moment and congratulate the Houston Health Department for their excellent work and collaboration with Houston Public Works, Rice University, and the CDC. The wastewater surveillance system center will allow a continued collaboration between the department and Rice University. The department will lead the CDC grant with a sub-award given to Rice University that will assist the Houston Health Department in sharing its expertise with cities across the nation and supporting public health. It also places the department center stage as the CDC develops substandard methods, standardized methods for this new public health tool. And I also want to acknowledge this is what they have done using wastewater to determine the level of COVID that is out there in the city of Houston. We're going to be expanding that now to monkeypox. So in about 2 to 3 weeks, as added supplies come in, they now have the technology and the ability to determine the level of monkeypox in the city of Houston through this wastewater system. Just like they did for COVID, they will now be doing it for monkeypox. So, council member, with your support and the other council members, we're going to draw down a little bit of money from the fund balance, give it to the health department specifically for the surveillance of monkeypox in our wastewater system, and that should begin in about 2 to 3 weeks. So I'm very, very excited about that. Now let me bring up Director Williams, who leads our Houston Health Department, to tell us more about this incredible national recognition. And he will be followed by Dr. Lauren Hopkins, and then followed by Dr. Kathy Ensor, and then followed by Dr. David Purse. Director Williams.
Thank you, Mayor. I want to express my gratitude and support for your support of our wastewater project, and maybe more importantly of the announcement that you made, because we are really looking forward to establishing an ongoing surveillance broader surveillance system for the city of Houston, and this is certainly the way to go. This designation of the wastewater epidemiology as the National Center of Excellence establishes our efforts as a model for the nation. The center will help the department share its expertise with states and cities across the nation. I want to tell you that that effort has already started. I'm really grateful for the scholars at Rice University for partnering in the development of the surveillance program. When we sought their assistance, the researchers dropped their regular research and were eager to collaborate, and I'm exceptionally grateful for that. Thank you for your long days and long meetings poring over results to find the best path forward. Our center partners are not just local experts, but I want to acknowledge the fact that they are national experts. The success of the program is due to these partners and to the visionary city leaders in Houston, especially our own Dr. Lauren Hopkins, our department's chief environmental scientist. Her exceptional vision kept this initiative moving forward and made it a model for the rest of the country. I want to thank Director Carol Haddock for her quick direction to quickly establish collections of the samples every week from the public works system, ongoing technical support, and national leadership of wastewater entities, and she's already committed to continue that. I want to thank also our own Dr. David Peirce, who played a critical role in his analytical assistance and interpretation of the findings for this public health intervention. Over the last 2 years, the Houston team shared its experience in sample collection, analysis, statistical interpretation, use as a public health intervention, and communication across audiences. The team provided technical assistance to states and local governments in the form of webinars, consultations, website materials, and a dashboard for training. These efforts are funded by the CDC Foundation, Rockefeller Foundation, and the National Science Foundation. The center will expand and continue these efforts by providing training to state and local health departments and other entities planning to conduct wastewater surveillance. The training will focus on Houston's experience and cover topics such as sampling, analysis, statistical interpretation, and public health intervention. Training will be followed with site visits so entities can actually visit Houston to learn techniques hands-on. Public Works will support the center by continuing and expanding engagement with other local wastewater utilities, technical presentations at regional, state, and national conferences, and frequent webinars to work with other entities and health departments in the development and execution of wastewater virus monitoring. Through the center, the health department, Public Works, and Rice researchers will also work together on key research projects to improve wastewater disease surveillance. I'd like to bring up Dr. Lauren Hopkins, our Chief Environmental Science Officer.
Thank you, Director Williams. It's, I guess, our honor here at the City of Houston to be awarded this Center of Excellence for Wastewater. As we worked on this project for the past 2.5 years, we did it because out of necessity, and without the support of the mayor and the director of the health department, Director Haddock of Public Works, and Dr. Peirce within the city, as well as our academic partners, we really wouldn't have been able to achieve what we did. Just to give you a tiny bit of background about how it came about when we began looking into using wastewater for surveillance for SARS-CoV-2, we really didn't have the expertise within the health department, and so we sought expertise from our local community. And we, initially, we had a team from Baylor College of Medicine as well as Rice University with our startup. And as we've moved along, we've continued this academic partnership, and I can't underscore the importance of city academic partnerships in moving forward on things that are on the realm of research but needed today. So with that, I'd like to introduce Dr. Enzer here from Rice to talk a little bit more about what the center will do.
Okay, thank you, everyone. So as noted by Rice University President Reginald DeRoche, this award exemplifies the value of strong partnerships between universities and the communities they serve. It's just simply been an honor to be a part of this very intense effort, and it truly has been a team effort over the last 2.5 years, and we're honored to play this leading role in the development of wastewater epidemiology programs nationwide. I want to underscore Dr. Hopkins' leadership of this program, as that it has ensured that the answers that we sought directly benefit the residents of Houston. And in March 2022, she was named to the National Academy's Committee on Community Wastewater-Based Disease Surveillance. So congratulations, Dr. Hopkins. So Dr. Lauren Stadler, who's our sort of golden nugget in all of this, she is an assistant professor of civil and environmental engineering at Rice and a national leader in wastewater science. She led the development of laboratory methodologies and streamlining the process from sampling to the data coming to the analytics team, which I head up. Stadler's lab and the Houston Health Department lab provide weekly measurements from these numerous, over 100 locations across the city, and we receive those every week. As Stadler notes, the new center will help us share our expertise with states and municipalities across the nation and put us center stage as CDC develops standardized methods for this new public health tool. As the leader of the analytics team, I'd like to thank the students and faculty of Rice University Statistics that have supported this effort and the phenomenal analytics team at the Houston Health Department. I would also like to acknowledge our Rice collaborators, Dr. Todd Tregan for the variant analysis and Dr. Ferris Eldada for the public-facing dashboard that I'm sure many of you see. Throughout the efforts, as we noted, we've answered important questions for the city. The wastewater information is combined with all other information that the health department has to prioritize public health response, and we look forward to doing more of that. These analyses will be expanded upon to identify which indicators are most useful in predicting increases and where and when to prioritize interventions. The center will also determine the most effective geographies, geographic scale, and temporal sampling frequency for wastewater testing for different surveillance targets. Dr. Stadler will also evaluate methods and workflow to analyze new wastewater targets, such as monkeypox, as we've noted, with the support from the Houston Health Department lab. And with this, I'll turn it over to Dr. Peirce.
Thank you. I'm just going to put a little perspective on this, if I could. So back in the beginning when this started, today we talk about wastewater pretty commonly, and our members, our friends in the media and such. But back when this started, it seemed like a pretty strange concept. And so I really want to thank Mayor Turner and the members of council because they were able to quickly appreciate that this was actually going to make a difference. And I don't know that everyone normally would have thought of, really, you're going to measure for the virus and the wastewater? How's that going to help us? Well, it does help, and it is not just a fun fact that we come up with every week. It's not just something to be put in the media. Our hospital partners every week for the last 2 years have been very anxiously looking for the value because it helps them manage the hospitals in terms of they can then anticipate. It became a very reliable predictor of how many patients with COVID were going to be coming to the hospital and what their patient load was going to be. And it gave us sometimes a 3-week heads up as to how things were going to change, which became critically important to the management of hospitals across the Houston area. And so you can imagine that those folks that run the hospitals have a very difficult job because the heart attacks, the strokes, the new babies being born, the hip fractures, the car accidents, all of those things continue to occur. And then they had to manage the extra load of COVID patients on top of that. And so if they had a heads up as to what was going to happen 2-3 weeks ahead of time, they were able to better manage. And as a result of this, I believe in my heart that lives were saved in hospitals because the hospital management got the heads up of this data. So it's not just an interesting thing. It actually was where the rubber met the road that made a difference in people's lives in healthcare. And as we move forward, we're looking at things like monkeypox and this technology. And here's the other thing, is looking into sewage water for pathogens is not entirely new. This has actually been, if you look in the public health textbooks, you'll see that hundreds of years ago they looked for it. What is different is the level of sophistication in the testing, the accuracy of the measurement, And the fact that they were to do it on such a huge scale in the fourth largest city in the nation, that is completely new. That was never done before. And we now have cities across the nation that are replicating and duplicating these efforts because it is so important, to the point where now the CDC has actually created funds to create a center of excellence. And our own folks here at Baylor participated, but at Rice University and the city of Houston are the proud recipients of it, as they well should be. And so I just want to point a little bit of thank you to the mayor and city council for understanding what may have sounded like a crazy idea was not crazy at all, and to put in perspective that this really made a huge operational difference that probably resulted in saving people's lives. Mayor?
And I'm going to bring up Councilmember Abby Kamen because we turned to the wastewater to determine the level of COVID that exists in the city of Houston. Now we're turning to the wastewater to determine the level of monkeypox. And I know a number of the cases are coming out of District C, and I know Councilmember Abby Kamen feels very strongly about it. Councilmember?
Thank you, Mayor. The announcement today that you sharing and your commitment to expanding the program to monkeypox, I think, is indicative of the leadership that the city of Houston continues to provide at the cutting edge of health and safety for all Houstonians, and not just for Houstonians, but for the nation. I came today to support not only our health department and mayor of the city, and congratulating everyone on the important recognition, but also Rice University. This could not have been done without the partnership, and that partnership continues to play a vital role in saving lives here in the city of Houston. So, Dr. Hopkins, to everyone, thank you for the partnership. It's invaluable. Mayor, thank you for your leadership as we continue to build upon, for the country, this new technology that was spearheaded right here in the city of Houston.
And again, let's acknowledge the City of Houston Health Department as the recipient of the Centers for Disease Control and Prevention's National Wastewater Surveillance System Center of Excellence Award for his work in wastewater epidemiology. Now, any of them can take any questions that you may have on this subject. Any questions on this announcement?
Related to monkeypox? Yeah.
Yes.
Yeah, I just have a few questions about monkeypox. And Dr. Purse, this may be more for you. Well, first of all, I guess if you could just address being able to monitor monkeypox in the wastewater, what that will do for you guys, predicting what's going forward, and what's actually happening in the community. How important is that?
Well, as you saw with COVID, we were able to get a better idea of how much COVID there really was in the community, because remember with COVID, about 40% of people had no symptoms, right? And so we were able to quickly realize the problem was bigger than we recognized from who was testing or who was going to the hospital. With monkeypox, we will learn, but remember with monkeypox, you've got a 2-week, maybe as much as a 3-week incubation period. And so, and again, with the symptoms being, fever, body aches, fatigue, those are common symptoms with a lot of viral illnesses. We could easily be underestimating how big the problem is. So this will give us a very objective view as to how big the problem is. And it will also give us an idea geographically where the problem may be worse than others. So back with COVID, we were able to recognize by zip code the areas that had growing numbers, that were growing at a faster rate than others. And then Director Williams and his team was able to then focus resources into those zip codes to try and slow things down. And it was, pretty effective. We anticipate being able to do the same thing with monkeypox. Now, monkeypox, you have to keep in mind, is a completely different virus. It has a different pathophysiology, and we will be learning as we go, because nobody's ever tested for monkeypox before. So to some degree, we're going to be learning as we go, but we anticipate it will translate into actual action that will benefit the community. That's what we're looking for.
One of the questions that we had was about those who are HIV positive. Many of them are taking the same medication as those who are on PrEP. Why are some who are HIV positive not in the same risk category as those who are on PrEP?
Yeah, this is a great question, and I'm glad you asked it. So right now, when we have significantly too little vaccine for the number of people, well, A, who want it, but B, who need it. And so let's talk about that. Our goal right now is to minimize the amount of spread of monkeypox within the community. People who are HIV positive and have compromised immune systems are at increased risk of having complications should they become infected. But most people, not all, but most people who know that they are HIV positive know that they are at increased risk and likely are not behaving in ways that put that at an increased risk of contracting and spreading the virus. So we're trying to target the vaccine on those people who are at greatest risk for contracting and spreading it through the community. So that's why the criteria are people who are known contacts of cases, people who have been diagnosed recently with syphilis or gonorrhea, because you know if you caught syphilis or gonorrhea, you're probably doing things that put you at high risk. People are HIV and on PrEP, or they're on PrEP because they know they're taking risks, right? And so we're trying to get at those folks who are the highest risk takers right now, recognizing that people that are immune compromised are at greater risk of having complications. But if you know you're immune compromised, we are really hoping that you're behaving in a way that doesn't put you at increased risk while this other group still is. Does that make sense?
Yes, it does. And then the county voted to use all their doses as first doses. Is the city doing the same thing?
So we are strategizing, another good question. We have to keep enough vaccine available to give a second dose. The situation we don't want to get into is where somebody's due for their second dose and we don't have it. So we are leaning forward in giving, with the first shipment, we initially gave half of it as first doses and the second half we held on to. Now as we're getting more doses, we're starting to give more first doses. The problem or the challenge is because we don't have a schedule as to when we're going to get the next shipments, we don't want to wind up in a situation where somebody's due for their second dose and we're out of vaccine. So we're trying to balance that as we move forward, but are we giving what would have been second doses, first doses? Yes. We're just being very careful about it.
And then my final question, is the city on the verge of declaring a public health emergency as we've seen in other places?
Yeah, so that's a bit of a legal question, and you want to handle that or you want me to?
I have had that conversation and brought it up. I don't think we're at that point yet, but we are having that conversation and looking at the rate in which the cases are coming and increasing. Certainly, if we had information from our wastewater, that would put me in a much better position. Would have more information. What I would say is that we certainly need more doses because the county gets theirs from us. You know, whatever we get, they get about 30%. 30%. And the demand is still higher than the supply. So we're looking at the numbers every single day, but we are having those conversations, talking with other mayors across the country, because in San Francisco and New York, they have declared public health emergencies. So we're not there yet, but we're continuing to look at the numbers.
Do you have a number or threshold that we would have to be at? Any idea?
If it gets to the point, for example, where we are doubling in just, let's say, a matter of days, and the supply is really not keeping up, it's not keeping up right now, but if it get further behind, then I would, for example, certainly look at declaring that and asking the state to declare it. And the primary reason would be to add additional pressure to the CDC and the state to provide more doses.
Thank you both.
Okay?
Mayor, can I add something?
Sir, Dr. Purse on that.
I'm sorry. So to your questions about vaccine, an important part of that discussion, it doesn't seem to be being had. So the vaccine is a 2-shot series, 28 days apart, 4 weeks apart. And then you probably don't start having your maximum protection until about 2 weeks after the second shot. So even if somebody got their shot today or last week or something, it's still a long time before they're going to actually have protection. And then the vaccine, we believe to be about 85% effective. It's not 100% effective. Like no vaccine is 100% effective. But what is nearly 100% effective, and you can get that impact right now, is by those people who are taking high risk by having frequent new sex partners or having multiple sex partners at the same time. You stop doing that. That is immediately highly effective. So while we talk a lot about vaccine is a great asset for us as a community, but it is nowhere near as effective as people paying attention to their behaviors, and again, to the HIV population, any population that's got immunocompromised, whether it be organ transplant or a diabetic patient, or there are a whole long list of illnesses that can cause you to have immune compromise. For those folks, if you're in a monogamous relationship and both parties are being monogamous, you're probably at essentially no risk. But if you're out having new sex partners and lots of sex partners, you're at pretty high risk. You have 100% control over that. Just want to make sure that we keep that in mind.
Any other questions on this topic? Anything?
Hi, Mayor Turner. We know that the federal documents now have been unsealed in the case against William Paul Thomas. We have more details, and I believe you are aware of more details about this as well. I'll tell you some of what's said. Specifically, in one instance, they say Thomas worked with a businessman to expedite a permit for an approval of a fire permit, a TCO, a temporary certificate of occupancy, that HFD, Fire Marshal's Office, would need to give them. What's your reaction to that allegation?
Well, it's an allegation. I'll have to have a lot more information than that.
Okay. It also says that Thomas, used his official position, his influence as a high-level member of your executive cabinet is not the right word, but you know what I'm talking about, committee, to influence the people, a specific person at HFD, to get this permit through. Are you aware that this took place?
No, ma'am. You're just now telling me.
Okay. Do you have plans to open an investigation, speak with HFD leaders?
Number one, this matter is already in the courts. So let me be very clear. If any employee does anything wrong, contrary to policy and contrary to law, then it's wrong, and I don't condone it.
So you don't plan to do any internal investigation to find out what's going on in your departments?
You're just, with all due respect, you're just telling me this. But I certainly, let me defer to legal. We have our own OIG. We have our own process. We are just now being made aware. The allegation really of what he was, let's say, pled guilty to, and again, assuming that's the case, that came out last evening, and now you're just telling me this. So let me defer to legal, and we'll handle it the way we handle all of these type of situations.
The city has an Office of Inspector General. It's housed in the legal department. Most of what it does is complaint-driven. It responds to complaints. But if it becomes aware of allegations that could be a violation of city laws or other laws, we will investigate. This information has just come to light. We will look at it. There's very little we can say about it. The process is confidential, and that for several reasons. Much like a federal investigation is confidential, we need the cooperation of people to find information, and what we're dealing with are allegations. So until we go through it all, we don't comment on whether something is likely or more likely. We just simply don't know until we complete the investigation.
So the federal allegations laying out the charge against Mr. Thomas are not enough for you all to start your own investigation? Is that what you're saying?
Well, I thought I was saying the opposite, that because this information has come to light, we will be looking at it.
Okay. And also, Mayor, earlier today, in comments about this case, you said that in regards to the certification, classification of bars versus restaurants, that the city had nothing to do with it. But the information here says that Mr. Thomas, again, used his influence to get a classification change for this bar owner. What are your response to that?
Bear in mind, it was the state that changed the classification from a bar to a restaurant. If the sales was 50% more on the food that was being offered than the beverages, then a bar could shift from being a bar to being a restaurant. That was the state's determination. And it's the TABC, the Texas Alcohol Beverage Commission, that determines and looks at the sales. It's not the city of Houston. That is TABC. That's what I said earlier today, and I stand by that. If there's anything else as relates to enforcement, then we'll have to check on that. But on the top of my head, I can't recall the specific details, but I do know that was a state policy through the TABC, and it's the TABC that looks at the sales, not the city of Houston.
Thanks, Mayor.
Mm-hmm.
And Mayor, I know William Paul has been in this position for a long time, even before
He's been an
you took
employee of the
office.
city of Houston for about 14 years,
14?
predating even me being here.
Okay. Okay. And earlier you talked about this is not the character that you know. Can you describe your disappointment if this turns out to be true?
If it turns out to be true, I'm very disappointed. It is uncharacteristic. He was the liaison to city council, and he did an excellent job. He did an excellent job. But his job was primarily to work with the council members, to address any of their concerns. When there were items on the agenda that we would take up almost every Wednesday, he would get with them prior to find out whatever concerns, questions that they had. That was his primary job. That was his role. Not, dealing with any other agency or department outside of being responsive to the council members. And from the previous administration to mine, in that capacity, he did an outstanding job. If the allegations turn out to be true, it is inconsistent to the person that I came to know. But be that as it may, let me be very clear. If any employee does something that's wrong, contrary to the policy, that is illegal, then we don't condone that. And we make no excuses for that. But what is being reported since yesterday and even today is just contrary, inconsistent to the person that I've come to know.
Thank you so much, Mayor. Any idea how long an investigation could last? That might be a city
Well, right
attorney.
now it is in the judicial process. So some things have been happening from all indications for quite some time. So it's already in the process. It's going through the process. And there's the Justice Department that I guess would have a lot more information than anybody. And instead of things being handled now in a drip fashion, and bear in mind, no one has talked to me about this matter or any other person on my team, on my executive team about this matter. The information that I am responding to is coming from reporters. But no one has come, no one from the Justice Department has come to me or my executive team and asked us or said anything or brought this matter to our attention. We're getting it from the reporters.
Thank you so much.
Would you like to hear from the Justice Department? Since you said they have it, are you inviting them to speak to you about this matter?
Now, come on now, you're a better reporter than that.
But you said no one has said there's federal documents that are available.
Now, you're asking me questions as if I know more than what I am saying to you. And what I'm saying, you know more than what I know. Okay? You're looking at information that I have never seen. And I can only respond based on what you are saying.
So you plan to look at the documents for yourself and...
Whatever information comes out, I certainly will take a look at it.
Thank you, Mayor.
Absolutely. So let me be just as clear as I can. No one is condoning any wrongdoing by anyone. We have 22,000 employees here at the City of Houston. Let me say to all 22,000, I want you to do your job. I want you to do your job with the greatest degree of excellence, okay? And I want you to adhere to the policies and procedures and to the law. Anything less than that is unacceptable. And I don't care who you are. But the actions of a few do not condemn 20-some thousand employees of this city who come to work each and every day. 1, 2, or 3 should not be reflective of some 22,000 employees. And these are people who have been working through COVID, through monkeypox. I've dealt with 7 federally declared disasters. And it's been employees that's been coming to work, and some of them have lost their lives. Now, do you have some people in our organization that act contrary to the policy and do some crazy, silly stuff? Yes. And we don't condone their behavior. I don't care who they are. I don't care who they are. But at the same time, the overwhelming percentages of employees that work for the city of Houston are good, hard-working people. I wish I could explain why some people go astray. I wish I could. I wish I could. But I will tell you, William Paul came to work. William Paul did his job. Did a wonderful job in the position that he held. But if it turns out that he did something wrong contrary to law, then everybody has to be held accountable. That's all I can tell you. Okay? Thank you all so very, very much.